Good afternoon, folks. This is Robert Chappell, Executive Editor of Madison365 with your daily update for Thursday, March 4th. Does that sound right? It is a pretty good day in the news all around in terms of coronavirus stuff. We'll go through some numbers for today, which are, yesterday we saw couple numbers that gave us a little bit of concern about some things, but numbers are looking better today, which is great. Just a ton of vaccination news today, and especially around Dane County, and then we'll have some other news for you as well after the break. So let's jump into the numbers first for today. More testing reported today, and more cases, but not significantly. It's not a significant increase when you think about how much testing there is. Exactly 1,000 more tests today than yesterday. 4,826 new results. That is either somebody testing negative, either somebody getting their first test ever and is negative, or somebody who's been tested negative before testing positive for the first time. Those are the 4,826 tests. There are lots more tests done of people who've tested negative before and tested negative again. We get about 30,000 of those every day, and they're just not. Those aren't reported in these new test results. So, of those new test results, 14% were positive. That's the same as yesterday. So it's 677 new cases identified today, reported today. So that's higher. That number of cases has been going up. However, because that's also kind of a rhythm of the week kind of thing. Like cases, more tests are processed as the week goes along each day. So there's more positive tests each day. So it's pretty typical that it's been Sundays and Mondays have been lower than Wednesdays and Thursdays. Now, this week, Wednesday and Thursday, is lower than last week, Wednesday and Thursday. So as a result, even though today 677 tests is higher than it was yesterday, which is higher than the day before that, our 7-day average is down to 522. That's a sharp decrease. It was 546 yesterday. It was 575 the day before that. So that average new cases coming down really fast. The other thing that dropped off really fast today is fatalities per day. For this entire week since Sunday, we're at 58 deaths for the whole week. Just 12 today. Now, say only 12 people died. That's terrible, life-altering news for 12 families. We don't want to gloss over that. However, we are now at 6,470 deaths. And then probably at this rate, in the next week or so, we'll pass 6,500 deaths. That's terrible news. But the 7-day average of deaths is now down to 11. That was 17 just yesterday. So that low number today, as compared to a low number last Thursday, or a higher number last Thursday, drops that daily average down precipitously, which is also good news. The other piece of really good news today, the one thing that really had me concerned yesterday was the 7-day positive test rate went from 2.1 to 2.4. 2.4 yesterday was still, in an acceptable range. It's still below 3. But anytime that number goes up, I get nervous. Today it went back down. Not all the way back down. It went down to 2.3, which means of all the tests that have been processed in the past week, which is probably about 150,000 tests total, 2.3% of those were positive. So we want to keep that below 3. Now, the fact that it's been below 3 for a couple of weeks now means that some activities that we wouldn't want to have done a month ago are probably getting to be safer now, such as having more kids in school. I still don't think going to bars and eating in restaurants is the best idea. In Dane County, for example, the new health order that goes into effect next Wednesday allows restaurants to open at 50%. I will not be partaking in that 50% of restaurant indoor dining. I get, it's probably okay, but I'm cautious, especially seeing how things turned around after June of last year. The positive test rate right now is about what it was last June. It's slightly higher. It was closer to 3 in June. And we saw what happened after we let our guard down and things went bonkers in July. And it kept going up all the way till November. A lot of people died that didn't have to. So given that, but we're hearing that the school districts are starting to open more. I think that's a higher priority for me than going to restaurants and bars, and probably safer than going to restaurants and bars, because schools are going to be really stringent about masking and distancing and things like that. Now, speaking of schools, we'll talk a little bit about let's talk about all this vaccine news. First of all, some vaccination numbers. Another piece of good news today is that the vaccine distribution continues to accelerate. With 35,000 people get their first shot just in the past 24 hours. We've had 23,000 people, almost 23,500 people, get their second shot. So that puts us at over 548,000 people fully vaccinated with both shots. 986,000 have gotten at least one shot. So we're closing in on 1 million people. At this rate, we might actually pass 1 million people tomorrow, having gotten their at least one shot. Now, we also know that Johnson & Johnson vaccines are on their way. In that case, there's only about 47,000 of those. Not a lot of that are being distributed. But of those, the one shot is it. You get the one shot, you're done. So so that puts us at almost 9.4% of the population has been vaccinated. So that's very good. Now, there is some additional news here as we talk about vaccinations. Speaking of the Johnson & Johnson, we know that, remember last week, it was the PHMDC, Public Health Madison-Dane County, had planned to open an Alliant Energy Center as a community vaccination site for teachers this week, specifically focused on prioritizing teachers and school staff and childcare staff, because they had, they're going to do 7,000 each week. And then they found out they weren't going to get as much supply as they thought. They had to cancel that, basically delay it by at least 2 weeks. Well, today they announced that they're actually going to be able to go ahead with that plan with Johnson & Johnson vaccine starting next week. So only 1 week late. Teachers will be available to get teachers and school staff and everybody in that priority group, which also includes childcare workers, will be able to get vaccinated at Alliant Energy Center starting next week. They have 7,900 doses of the Johnson & Johnson single dose vaccine. So that's good news number one. Good news number two, SSM Health last week started vaccinating teachers in Waunakee and Sun Prairie. Next week, SSM Health is going to vaccinate some members of the Madison Metro staff. They're going to have enough vaccine to do 1,200 people. They're going to start. It's going to be the first shot is going to be next Friday at La Follette High School. So they're going to do kind of a mass vaccination clinic specifically for the Madison School Community Recreation childcare staff first, because recognizing that those folks have been working in person this entire time, making tremendous sacrifice, taking a tremendous risk to provide childcare for Madison Metro School District families. So they're going to be first. That's about, I'm told by a school board member, that's about 400 people, which means they'll have enough vaccine for another 800 or so, which is not enough to do the rest of the Madison Metro staff. It's a couple thousand people. So, but they haven't yet decided who the next priority will be for those, but they're going to soon. So the district will be communicating with staff soon about who will be next up and who else can come on that next week Friday to get their first shot, and then again on April 9th to get their second. Now, in the meantime, several school districts around the area, and I haven't really reported on this yet because I'm just learning about it, but school districts around the area are becoming their own medical supply buyers. I just found out that in Mount Horeb over here, 91 teachers got vaccinated yesterday because the school district, rather than wait for the county, just went out and found some vaccine and bought it and administered it to their staff. It's a little bit absurd that school districts have to do that right now, but that's what they're doing. Additionally, it seems as though Walgreens appointment, like we talked about the other day, are still are available. It's a little tricky to get. You might have to travel outside your community, but you have to make both appointments at once, and they have to be 3 weeks apart. So you have to do a little bit of planning, but it seems like those are federally sourced. So teachers are eligible for those. So there's lots of different ways teachers can be getting vaccinated. Now, the other piece of vaccine news that I want to pass along is UW Health put out a release today describing their efforts to specifically target people of color for vaccinations, understanding that that COVID-19 affects people of color more, disproportionately. So, of people over 65, they've been prioritizing and prioritizing invitations to come get vaccinated to their particular patients who are people of color. And so now, as of now, 50% of UW Health's patients who are Native American and over 65 have gotten vaccinated. That's a pretty small population, but they've been able to vaccinate half of that population. Similarly, among their Latino population, who are UW Health patients and who are over 65, 44% have been vaccinated. Of Black folks who are their patients and over 65, 39% have been done. And of white patients over 65, 35%. Now, understanding that still means more white people have been vaccinated than all those other groups because Dane County, it's mostly white, right? But the point is, proportionally speaking, among UW Health patients alone, people of color are getting that priority and they're getting vaccinated at higher rates, which is good news. They also committed, they're actually hiring people. They're hiring a vaccine patient educator who work with those communities over the next year, because it's going to take that long, let's be real. It's over the next year to really get vaccine into those vulnerable and marginalized communities. All right, so that's Jess asks, have we talked about the vaccinate.wi.gov map? Yes, I have. I've talked about how it's riddled with errors and you shouldn't use it. You should use it. You can use it. You can use it to click on wherever there's a little blue dot wherever you live, and click on it, and you'll see a list of locations and organizations that allegedly offer a vaccine. So that's a place for you to start. We found out that we did a small sample. It wasn't a scientifically representative sample, but of all the places we called, we being myself and some other reporter friends around the state, about half were wrong. You heard that it was fixed this morning? I have not heard that. They have not emailed me back when I asked them about it. They haven't emailed me back yet. If that's true, that's great. In fact, I can take a minute right now and check. But the one of the things was that they had they had school district listed as place where you can get vaccine, and that's not true. If it's fixed, that's great, and you can use it. There's a lot more to the website than the map. you can go to, it's a registry, right, where you can schedule an appointment. Although there's probably better ways to schedule an appointment. But also you can take a questionnaire to determine your eligibility, and you can put in your registration code if you've gotten one from your provider. I'm just looking at the site right now. Rock County, La Crosse County, and Greene County are all scheduling through this system, through this vaccinate.wba.gov. And more counties will be added later. I would still be very skeptical of the map, to be honest. If it's fixed, great. I've sort of been skeptical of it. But like I said, even if it's wrong, like take the time to check it out, because there's a reasonable chance that if there's 4 or 5 places listed near you, that a couple of them will have vaccine available. So it's worth your time to make that call. All right. Now, this is that's basically all, everything I have on coronavirus. We'll take a short break, and we'll be back with more local news right after this.
And when you understand who you are, like really understand who you are, then you're not swayed by people's perceptions, or if they're talking about you, or if they don't like you, or if they get mad at you. Like, it's not the end of the world. It's just, and we live our lives based on what other people gonna say and think and do. That's slavery, man. That's a form of mental, spiritual slavery, when every day I gotta wake up and be concerned about what somebody else gonna think, say, or do to me. God didn't send me here to live like that. So
that's the quote for the whole podcast right there. That's slavery. Woo.
That is the clip from today's episode of Real Talk with Henry Sanders. It's our weekly interview show. Jason Fields, former state representative from Milwaukee, is now the CEO of Madison Regional Economic Partnership here in Madison. Really interesting conversation about his battle with depression and alcoholism, and how he got into finance to begin with, and coming out of Milwaukee. Really fascinating conversation. Madison365.org/real talk. It's right on the top there. You can watch it on YouTube or listen on as a podcast. Anywhere you get your podcast, just search for Real Talk with Henry Sanders, and you'll find it that way, and you should subscribe. Other news today, Representative Sheila Stubbs, there seated in the middle of that photo. She has a bill in the Assembly that is currently going through the process. It took the next step yesterday, and it will be before a committee next week. Would remove or loosen or severely, significantly loosen license restrictions on hair braiding, which is a thing that a lot of us white folks don't know about. Hair braiding, natural hair braiding, is an important cultural practice and an important business opportunity for a lot of Black people. And it's not the same as running a hair salon, but it is licensed as if it is. You have to have a salon license to basically do natural hair braiding. And that's a significant impediment to people who are trying to be entrepreneurial, run a small business out of their house, doing hair braiding. And as a result, it's not easy to get your hair braided around here. My oldest son tried to get his hair braided. He had to go to Rockford, Illinois to get it done. To help take care of that, Sheila Stubbs has this bill that would loosen that restriction and allow those businesses a little bit easier time to get by. Also today, on the federal level, the United States House of Representatives passed the George Floyd police reform bill that would do a lot of things related to federal oversight of policing. it would make data easier to come by, which is a big deal for journalists. It's just really hard to know, like how many people have been shot by police. We don't know. There's not a good central database for that, and this bill would help. That's one of the many things that this bill would accomplish. It was passed along mostly party lines in the House of Representatives. 2 Democrats voted against it, including Wisconsin's Ron Kind, who wanted more. The reason he voted against it was, he said, it didn't have enough funding for implicit bias training and that kind of stuff. Also at the federal level today, the $1.9 trillion stimulus package passed a procedural vote, 51-50, with Vice President Kamala Harris casting the tie-breaking vote there. This is Dr. Lori Carter. I am going to be talking to her in about 5 minutes. She is the new president at Lawrence College in Appleton, and 147-year history of that university. She is the first person of color to lead as president. That was just announced today, and I was lucky enough to schedule an interview with her at 4:30. So I'm going to wrap up here pretty soon and hop on that Zoom, and so I'll have that story for you tomorrow. Finally today, so 2 pieces of really good news for Brewers fans. First of all, the Brewers agreed to a 2-year, $24 million deal with Jackie Bradley Jr., adding some outfield depth in center field. Lorenzo Cain will be the starting center fielder for sure, probably. But Jackie Bradley was an All-Star in 2016, Golden Glove winner in 2018, and has played with the Boston Red Sox for 8 years. He's 30 years old. So, sort of toward the tail end of the career, but it should be an excellent addition to that Brewers outfield. And maybe even better news, you can actually go watch a play this year. They've been cleared and approved by the Milwaukee County to have 25% capacity at American Family Field from erstwhile Miller Park. That amounts to about 11,000 fans per game. I have not heard yet when tickets will go on sale, but it'll be pretty soon, I would imagine. And I would predict, I have no insider information. I wish I had insider information about the Brewers, but I don't. I would imagine that percentage will increase in the coming months. So they'll probably sell 11,000 tickets for the first couple of games soon. And I would imagine that capacity number will go up if we all do our part and keep that positive test rate below 3% for the state. If we all keep getting vaccinated, if more vaccine comes, if we continue to accelerate the vaccinations, we will be back at baseball games this summer. We'll be at soccer matches this summer. Our kids will be in school, and I will come here every day and talk to you about other news other than virus things, which I look forward to very much. So that is my update for today. I appreciate you staying with me, and I appreciate your comments and questions. And it's a beautiful day, and it's going to be a beautiful weekend, it sounds like. So get outside, enjoy it, and I'll be back here tomorrow at 4 o'clock. Until then, have a wonderful night.
This is 365 Media.